Hi friends, welcome to our journey in exploring what is infertility. In this video, we will highlight what is infertility, what are the causes, what are the treatments, the actions that could prevent infertility. I hope you are enjoying this video and could get the benefit from this video. Most common definition is an inability for a couple to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. Infertility may be caused by a number of different factors in either the male or female reproductive systems. However, it is sometimes not possible to explain the causes of infertility. These are the examples of the causes. For women, it is caused by scarring from surgery, fibroids, and pelvic inflammatory disease, while for men, infertility could happen caused by problems at semen and sperm ejaculation disorders and hypogonadism. Do you guys actually think that infertility is a problem? The answer is yes. WHO, World Health Organization, estimates that 1 in 6 people are affected by infertility. In the United States, married women aged 15 to 49 years with no prior birth, about 1 in 5 are unable to get pregnant after 1 year trial, while in Malaysia, infertility ranged from 10 to 50% of couples that affected by infertility. Besides, fertility rate is dropped from 4.9 children per woman in 1970 to 1.7 on 2021. These are two charts where the first chart shows total fertility rate by selected countries. We can see most of Asian countries are having a decreased rate of fertility, while the other chart is focused on total fertility rate in Malaysia. It is decreasing from 4.9 in 1970, decreased to 2.0 in 2013, and also decreased in 2021, which is to 1.7. And the latest one, the total fertility rate is dropped to 1.6 in 2022. It is shown that infertility problem is actually affected all countries around the world. Most of people have a perception where infertility is only caused by women. But do you guys actually know that infertility occurs among males is possible? The arising question, what the actions or what to do if couples out there facing infertility problems? There are many ways they could try on, but these are some of the ways. First, medical evaluation, where both partners should undergo a comprehensive medical assessment. Secondly, lifestyle changes such as maintaining a healthy weight, eating a balanced diet, exercising regularly, avoid smoking and excessive alcohol. The last one is medications. Fertility treatment and drugs may be prescribed by the doctors to stimulate the ovulation in women or improve sperm production. You guys must wondering why we need to acknowledge the infertility issue. First, emotional and psychological impact. Infertility can cause emotional distress, including feelings of grief, frustration, and depression. Secondly, social and cultural significance. In some cultures, having children is a central aspect of family life, whereby infertility can lead to social stigma. Third, health implications, where infertility can be a symptom of underlying health issues such as hormonal imbalance, reproductive system disorders, or chronic diseases. Lastly, personal fulfillment. For many people, having children is deeply personal and important goal.
Across the decades, the world has witnessed a remarkable transformation in family planning. The once bustling cradle of 1950, where women bore an average of 4.5 children, has gradually given way to a quieter nursery. Today, the global fertility rate stands at less than 2.5 live birth per woman, a testament to changing societal norms, improved educations, and access to contraception. As we peer into the crystal ball of projections, it reveals a future where the lullaby of motherhood may become even softer, echoing a delicate balance between population growth and individual choices. So, let's start with some of the highlights on cumulative success rates from SART's latest report, based on data from 2018. For those under 35, the chances that one egg retrievable cycle falls to 55.6%. For people ages 35 to 37, this falls to 40.8%. For people ages 38 to 40, the rate is to 26.8%. For people ages 41 to 42, it's 12.6%. And for people ages 43 and over, is 3.9%. Now, for initial success rates, the live birth rate for one egg retrieval and one embryo transfer is often lower because it's only accounting for that one initial transfer. For people under 35, the chances that the first transfer cycle leads to a live birth is 41.4%. For people ages 35 to 37, this falls to 31.6%. For people ages 38 to 40, the rate is 22.3%. For people 11.7%. For people ages 43 and over, it's 3.8%. And these numbers don't take into account pre-implementation genetic testing. Infertility is a condition affecting both men and women that hinders the ability to conceive a child naturally. It can arise from a variety of medical, environmental, and lifestyle factors. Understanding the underlying causes of infertility is crucial for diagnosing and treating the condition, offering hope to many couples trying to start a family. So, let us dive in what are the causes that lead to infertility in men and women. For men, semen and sperm. A common cause of infertility in men is poor quality semen that fluid containing sperm that's ejaculated during sex. Possible reasons for abnormal semen include a lack of sperm. You may have a very low sperm count or no sperm at all. Sperm that are not moving properly. This will make it harder for sperm to swim to the egg. Abnormal sperm. Sperm can sometimes be in an abnormal shape, making it harder for them to move and fertilize an egg. Next, ejaculation disorders. Some men experience ejaculation problems that can make it difficult for them to release semen during sex. Last but not least, hypogonadism. Hypogonadism is an abnormally low level of testosterone, the male sex hormone involved in making sperm. It could be caused by a tumor, taking illegal drugs, or Klinefelter syndrome, a rare syndrome involving an extra female chromosomes. For women, scarring from surgery. Pelvic surgery can damage and scar the fallopian tubes, which link the ovaries to the womb. Cervical surgery can also sometimes cause scarring or shorten the neck of the womb, which is a cervix. Next, fibroids. Non-cancerous growth called fibroids in or around the womb can affect fertility. In some cases, they may prevent or fertilize egg attaching itself in the womb, or they may block a fallopian tube. Last but not least, pelvic inflammatory disease. Pelvic inflammatory disease, PID, is an infection of the upper female genital tract, which includes the womb, fallopian tubes, and ovaries. It is often caused by a sexually transmitted infection, STI. PID can damage and scar the fallopian tubes, making it virtually impossible for an egg to travel down into the womb.
Now let's explore the different infertility treatments available. As we already know, there's a lot of infertility treatment, which is medications, surgery, and the one that we will discuss a lot about today is assisted reproductive technologies, ART. ART procedures involve handling sperm and eggs outside the body to achieve fertilization. Okay, first we have an intrauterine insemination, IUI. Second, in vitro fertilization, IVF. And intracytoplasmic sperm injection, ICSI. But today we'll discuss more about a gestational surrogacy, a type of ART that allows another woman, the surrogate, to carry a pregnancy for the intended parents. But the best treatment option depends on the cause of infertility and your individual situation. Consulting a fertility specialist will help you understand all the available choices. And now, let's delve deeper about gestational surrogacy. Hi everyone, today I will explain gestational surrogacy, a way for some families to have a baby. Now imagine a team effort. Intended parents want a child and a gestational carrier who helps them carry the pregnancy. First, the intended parents find a kind and healthy woman, the carrier, to help. They all get checkups to make sure everyone's ready. Then, depending on the plan, the intended parents might use their own eggs and sperm, or they might involve egg or sperm donors. Next, here's some medical magic. Doctors take eggs and fertilize them with sperm in a special lab dish, creating tiny embryos. The carrier's cycle is timed to match the intended mother's cycle to prepare her body for the embryo. Then, the doctor carefully places a healthy embryo into the carrier's uterus. The carrier might take some medications to help the pregnancy be strong. Finally, she carries the baby for 9 months, just like any other pregnancy, and delivers a healthy baby for the intended parents. Legal agreements are made beforehand to ensure everyone's rights and are protected, and typically, the intended parents become the legal parents of the child. Now let's move on to the fatwa and law of surrogate mother in Islam. Based on the gazette from the government of Selangor, it is being stated that the surrogate motherhood method is illegal in Islam. As you can see, there's a piece of paper right there, and that statement, and here is the translation of the sentence. Using the method of surrogacy to obtain offspring is forbidden by Islam, even though the sperm and ovule are taken from a legitimate married couple, because it will cause confusion about the lineage of the child that will be born. In this ayah, it is stated that none can be their mothers except those who gave birth to them. So, in Islam, it seems that the surrogate mother is the real mother. But biologically, the intended mother is the real one, because the baby is carrying her genetic information. And this will cause confusion about the lineage of the child. And therefore, that's why it is haram in Islam.
So now, let's focus on ways to increase fertility for men. First, exercise regularly. Besides being good for your general health, exercising regularly can boost testosterone levels and improve fertility. Studies show that men who exercise regularly have higher testosterone levels and better semen quality than inactive men. However, you should avoid too much exercise as it may have the opposite effect and potentially reduce testosterone levels. A study in infertile men showed that taking 1000 mg vitamin C supplements twice a day for up to 2 months increased sperm motility by 92% and sperm count by more than 100%. It also reduced the proportion of deformed sperm cells by 55%. A study in infertile men showed that taking 1000 mg vitamin C supplements twice a day for up to 2 months increased sperm motility by 92% and sperm count by more than 100%. It also reduced the proportion of deformed sperm cells by 55%. Third, get enough zinc. Zinc is an essential mineral found in high amounts in animal foods such as meat, fish, eggs, and salads. Getting enough zinc is one of the cornerstones of male fertility. Observational studies show that low zinc status or deficiency is associated with low testosterone levels, poor sperm quality, and an increased risk of male infertility. Also, taking zinc supplements increase testosterone levels and sperm count in those who are low in zinc. Furthermore, zinc supplements may reduce the decreased testosterone levels that are associated with excessive amounts of high-intensity exercise. Now, let's focus on ways to increase fertility in women. First, get a bigger breast. Eating a substantial breast may help with female fertility, particularly if you have polycystic ovary syndrome, PCOS, a major cause of infertility. A 2013 study found that eating a larger breakfast may improve some of the hormonal effect of PCOS that affect fertility. More recently, a 2021 review of studies found that higher calorie intake earlier in the day may improve PCOS symptoms. When choosing breakfast foods, consider eating something with fewer carbs. Research suggests carbs may increase inflammation for those who with PCOS. Second, minimize on carbs. Following a lower carb eating plan where less than 45% of calories come from carbohydrates is generally recommended for people with PCOS. For example, if you eat around 1,800 calories a day, that translates to about 200 grams of carbs. Several studies indicate that managing carb intake provides beneficial effects on some aspects of PCOS. Just don't overdo it. Eating too few carbs can lead to health issues. Third, aim for moderate weight. Having overweight or underweight may affect fertility by affecting your menstrual cycle, particularly ovulation. If you have obesity, 2020 research suggests that losing 5% of your body weight, along with maintaining a lower body mass index (BMI) and managing triglyceride levels, can increase fertility. Keep in mind that what's considered a healthy weight varies from a person to person, and BMI isn't a perfect predictor of health. Many factors, including your unique body composition and exercise habits, affect your weight. Talk with a healthcare professional to determine whether losing or gaining weight would improve your fertility.
Summary, by educating ourselves and others, we can foster a more supportive environment for those affected by infertility. Remember, many couples facing infertility have successfully built families through various treatments and options available today. If you or someone you know is dealing with infertility, seek help from healthcare professionals who can offer guidance and support. By advancing our knowledge and supporting research in reproductive health, we can bring hope and solutions to countless couples. That's the end of our presentation. Bye!